Welcome back. We have our Medicare and health insurance experts with us today. Catherine CVA from AARP, Steve Edmonds from Alliance Insurance Services. Catherine, this person says, if you're disabled and have not been able to work for over 3 years, can you get Medicare?
You can if you apply for Social Security disability. Medicare does not kick in unless you're 65 or you are disabled and Social Security has deemed you eligible for disability, then you can get it.
Okay. This question, Steve, is one right for you. Isn't it true that the coverage gap, also known as the donut hole, will be going away in 2025? If so, how does that look?
Yeah, bravo. Somebody is keeping up with the news reports there. So, absolutely, this is probably one of the most sweeping changes that we've seen in Medicare. I'm going to say in years, and it's definitely going to be a really good thing. So, right now, the donut hole will be going away for 2025. And then your out-of-pocket maximum expense for drug coverage will be coming down from $5,000 all the way down to $2,000 in 2025. There will still be some deductibles and things like this, but this is going to be a huge help for folks that find themselves taking a lot of prescription medications. It's going to be a really big help, and so we're kind of excited about that. And but that just look for more reports to come out on that as the year progresses. But that's definitely in the works for sure.
Okay, and did you say the prices on that?
Well, the prices on it, on a lot of drug plans, it's relatively cheap anyway. Most of your prescription drug plans run 20, 30, 40 bucks a month. They won't change in 2025, I don't think, because carriers don't really have time to react to all this yet. I think it'll be 2026 before we know if there's going to be price increases on the plans. I don't think that'll happen in 2025, but we could see price increases on prescription drug plans and Medicare Advantage plans in the future because of this. But still, I think the good outweighs the bad on it.
Right, because the out-of-pocket goes from 5,000 to 2,000 next year.
Yeah.
Okay.
Yeah.
That's a big deal.
Yeah.
That's a big deal. Catherine, this person says, do I have to give up my job insurance when I retire?
No, you do not. As long as it's credible insurance, you can waive your Part B Medicare. And then when you retire, you can submit to start your Part B along with your Part A. But again, 65, no matter what, working or not, sign up.
That's right. And defer that Part B. If you don't check a box that you're deferring, they just think that you don't want it, and then that's where the penalties come in.
Absolutely.
Steve, this person says, what if I'm already retired and on disability? Do I get Medicare benefits?
You can get Medicare benefits, as Catherine said a while ago. If you've applied to Social Security for Social Security disability, if they accept you, then you can get Medicare after that, and then you can also get Medicare insurance after that. So, but you have to apply for Social Security disability in order to get that benefit.
And I know both of you probably have thoughts on this next one. Is it better to get a supplemental or a Medicare plan, a regular Medicare plan?
That depends. Okay, so on a Medicare supplement, the really good merits with it is most of the time it's practically 100% of your medical coverage. So basically, it's very predictable. Your annual out of pocket is basically going to be whatever your premium cost is because it's going to pay everything. The other hand, the Medicare Advantage is going to be a zero premium, so you're not going to be paying a premium at all, but you're going to be paying a lot of co-pays. You're going to be paying a lot of little out-of-pocket expenses here and there, and you're going to have a maximum out-of-pocket most of the time of around $3,500, $3,600, $3,700 a year. So the good thing about Medicare Advantage, you get extended benefits like dental, vision, hearing, over-the-counter drug products, and many more bells and whistles. But it is not the most robust medical coverage. The Medigap or Medicare supplement is the best medical coverage you can get, period, on Medicare.
Yeah, and I would just add, it's important to know your own health conditions and what you need from care to help you make that decision. And it may be different from your spouse. So you really want to think about what your own medical care needs are.
And Catherine, I've got a follow-up. Someone's asking, do you receive any notification about enrolling in Medicare on your 65th birthday?
No. You may receive some notification from people in your community who have data about you that says Medicare is coming up. But you can't really depend on getting any notification from .gov to warn you of that.
That's interesting, because you would think it would be something normal like the IRS sends you stuff and whatever else, but this is not one of those things.
That's true.
Okay, you got to be able to go online. And remember, 65, it's at 3 months before the month and 3 months after. Thank you both for your time and your wisdom. We appreciate it. If you missed any of this, you may need to go back and listen to it. These interviews will be posted in the Who Wants to Know section of our website.